Thank you for joining us in another Green Spotlight episode. We have with us our CTE Teacher Edition, Dr. Merriman, helping us in understanding her career pathway. So, welcome, Dr. Merriman. Do you want to introduce yourself again?
Yes, my name is Alejandra Merriman. I am the CTE patient care pathway teacher. I am a certified athletic trainer, and I am also a part of the change to change our law and public service magnet to our new sports medicine and law magnet, where our sports medicine program starts off sophomore year, where students take medical terminology, and then their junior year they take sports medicine. And depending if they're in the fire and EMS magnet or the sports medicine and law magnet, our seniors will take physical therapy or they'll take an emergency medical technician course their senior year.
Wow. Um, so, to understand a little bit about the career pathway that we offer at Dorsey, specifically yours, can you describe a little bit more what the CTE pathway is all about?
Yeah, so our patient care pathway is we're in the health science and medical technology industry sector, and patient care pathway deals with any healthcare profession that directly deals with patients. I specifically, as an athletic trainer, am under the sports medicine umbrella. So our pathway is specific to sports medicine. But regardless of that, if you're interested in medicine, whether that be nursing or dentistry or physical therapy or becoming a physician, all of the courses, the way that they're set up, they set you up to either go directly into a post-secondary program or a job, for example, as a physical therapy aide. So our sophomore students take medical terminology, and that is a foundational course that sets up our students to learn about the body systems, to learn about basic medical terminology that they will continue to use their junior and their senior year. And then their junior year sports medicine is more of an emergency acute injury based course where kids will learn how to they'll learn an abundance of anatomy, learning to label anatomy. They'll learn about athletic and just in general injuries to the entire body, and how to acutely care for those injuries, whether it's applying a vacuum splint or dealing with a traumatic wound, where they become first aid and CPR certified in that course, as Heart Saver, American Heart Saver certification, to learn how to use an EpiPen, or learning how to apply an ice pack or a heat pack. That's their junior year, applying those basic skills, taping and bandaging. And then their senior year is more career specific, where if they decide, they want to do more of a physical therapy route, then they'll take physical therapy their senior year, and that's when they learn basic concepts in physical therapy like tissue healing and biomechanics and kinesiology. And they learn things about how to set up crutches for a patient, how to put on a boot on a patient, how to set up a rehab program for a patient, the do's and don'ts of rehab programs. And then for EMTs, that's for fire EMS senior students in that magnet who want to go in emergency medicine, whether it's an EMT or a paramedic, or just in fire and EMS in general, where they learn specific skills as an emergency responder. So they'll become BLS CPR certified, which is a more advanced level of CPR and first aid certification, which will prepare them. And if they decide to go to paramedic or EMT school, that is a requirement that they have to have for them to apply to the school. So that will be one requirement marked off. And though in that course, they learn more specific emergency skills, like the difference between an OPA and an NPA, an oral pharyngeal or a nasopharyngeal insert to open the airway, those type of things where it's more emergency specific. So the pathway, it all leads to healthcare profession, but it just depends on the student's preference and what magnet is what they decide to take their senior year, in which they'll get specific certifications for each course at the end of our concentration and capstone courses, which will assist them post-secondary.
So, growing up, I think most of us grew up with the idea of just a medical doctor, and you just described so many other opportunities in the healthcare profession. Can you mention a few career choices that the students can explore, after they finish with this career pathway?
Absolutely. They're immediately after high school, they could go and apply to become a physical therapy aide in a physical therapy clinic if they took our physical therapy course. They learn enough anatomy and medical terminology foundational skills to work in a physical therapy clinic and understand if a physical therapist told them, can you please show this patient how to do sideline leg raises? They understand that and they actually learn how to perform those in class. So that is going to directly set them up to become a physical therapy aide if they choose to. If they don't choose to and they want to take their post secondary education further to become a physical therapist, then they're just going to reinforce this stuff throughout physical therapy school to become a physical therapist. They can also choose to go the physical therapy assistant route, which is where they would apply to physical therapy assistant program directly out of high school. Um, that's 2 years, so that is a quicker entry as well in the physical therapy field. They can go to school to become an athletic trainer. They get enough knowledge to become an LVN and go to community college, or to go to school to become an RN. They also um, have skills to become anything in emergency medicine, paramedic, an EMT. They also have learn the foundational skills and knowledge to go apply to medical school. Um, where for me, it's specifically under the sports medicine umbrella that we have more partnerships with, but we do have enough exposure with guest speakers where if I'm not teaching them about a career and the students are interested, like they want to become a veterinarian, then I can find them someone, a veterinarian that they can speak to and get them that exposure, because that is not my healthcare profession. I have no experience working with animals, but I can find them someone and have them guest speak or guest lecture to get them the exposure. Regardless, they're still learning. They still have to know medical terminology as a vet. They still have to know anatomy of the animal. And through some of our equipment, like our anatomage table, we have animals that they can learn from in the actual table to explore the anatomy if that's a career path that they chose.
Wow, very interesting. And just so we know a little bit more about the program at Dorsey, can you describe a little bit why Dorsey? Why should you go to Dorsey if this is something that is interesting to you? What makes CTE programs at Dorsey some of the best CTE programs in LAUSD?
We have one of the best sports medicine facilities in LA County at a high school. Um, we have things that not even private schools like Mater Dei or St. John Bosco have in our classroom. We are an industry specific school, so all of our CTE programs have industry specific equipment, and we set up our classrooms to be specific to our industry. So we don't have normal desks. We have treatment tables as desks that are found in everyday clinics. If you go to sports medicine clinic, if you go to a physical therapy clinic, or if you go to a chiropractor, you will see these exact same tables in that industry. We have equipment like an anti-gravity Alter-G treadmill that is commonly found in physical therapy clinics, and we were the first high school in LA Unified to have that treadmill. And our physical therapy class uses that in their rehab lesson, where they learn, let's say they chose ACL for their project, and they would learn how to use the anti-gravity treadmill to assist a patient in an ACL rehab program so that they can get back to running. We also have lots of equipment, spine boards, vacuum splints. We have industry specific equipment that you don't find at every high school to give our students exposure, hands-on skills, work-based learning, so that they can get the exposure that they need to find out if this is what they really want to do, especially in the healthcare career. We work a lot of hours and we have to be dedicated and passionate about what we do because we're helping people get back to their lives, and that requires a lot from us. So getting that exposure to everything, how to do CPR, what to do if you encounter someone who is unconscious, those type of things, is preparing them regardless of the healthcare profession that they're going into. And we have a lot of partnerships and a lot of guest speakers. We have partnerships with USC, where we have sports resident physical therapists come to our high school. We have a new partnership with Azusa Pacific University and their student athletic training program. We have partnerships with Cedar Sinai, where they have helped provide lots of opportunities in terms of guest speaking, in terms of tools like concussion goggles, so the students experience what it's like to have a concussion. Kind of, you put these on, and then makes them experience symptoms that normally a patient would experience with a concussion. We also have a recent partnership with Charles Drew University, where we did our first sports medicine summer camp in 2019. And unfortunately, due to COVID, we haven't had it again. But it is an annual thing that we set up with Charles Drew University, where we have a week-long sports medicine camp that exposes our inner city youth high school students to sports medicine, where we also have guest speakers come to the camp. They take a tour of Charles Drew's campus, and they spend a day there, and they get exposed to more healthcare careers. And man, we have so many partnerships. There's too many to think of. I'm working on a new partnership with Cal State LA. We have a new partnership with LA Promise, where they're assisting our students with mock interviews with healthcare professionals of their choice. We have a lot that, looking on the outside, you would not think Dorsey has. And that's one of the things that I dislike the most about our misconception. They think of Dorsey and they think of inner city youth, and they're like, well, they can't possibly have that. But we have that in more in our programs, not just my program, but all of our CTE programs. Every year they grow more and more, they expand. We started off in a classroom with little to nothing, and now with over $500,000 worth of funding, we have a classroom twice the size. We have our own facility. It's grown and grown even more. All of our CTE programs continue to grow, and most importantly, we grow to fit our students. So, EMT is new this year, so I applied for funding to get things specific for that class because it was an interest with our fire EMS course. So it's whatever meets the needs of the students. Our CTE programs make sure that and we're thankful to do so during with funding, that we are able to get whatever we need to benefit our students.
Well, thank you, Dr. Merriman, for talking to us a little bit more about the program. But I know there's so much information. You gave us a lot, but there's so much more that I know that you're on social media. I know that you have a website. If people want to go to dorseydons.org, there's a link there so they can explore a little bit more. I'm sure they can contact you if they have any questions.
Absolutely.
Anything that you want to add?
No, just come on over to Dorsey. We
Reach
would
out.
love to have you. We have a world-class education right in the heart of LA. Don't be scared to come on over, and we'll make sure that you have a great experience here.
Thank you so much, and thank you all for this episode. Stay tuned for another CTE episode coming very soon. Thank you so much.
Thank you.